Kind of the crux of my job is really just maintaining relationships. So I do a lot of meetings with other national nonprofits, other national organizations who are working in the healthcare space, along with the administration. And we just talk about what's working, what our regional offices are doing, the needs that we found, and new strategies of how to kind of tackle those issues. And then we kind of get to work on implementing that. So
Young Invincibles was founded by a group of friends who realized that people's voices weren't being heard in the healthcare debate. Young Invincibles works with committed individuals across the country by providing help to those seeking affordable healthcare. By doing this, they are bringing awareness and hope to young adults who struggle to find the security they truly need.
Well, I think one of the biggest misconceptions is the idea that young people don't want or value health insurance. We kind of named our organization Young Invincibles, ironically, because of this idea. Young Invincibles was a health insurance company term that health insurance companies used to refer to young people as the Young Invincibles, those who, felt like nothing bad could ever happen and health insurance just wasn't worth the money. But what we found through our work is that that's just really not true at all. Young people, they want health insurance. They know the value of health insurance. They want to feel that kind of peace of mind, that protection, both, for their health so that they can see a doctor when needed, but also the financial protection. So if you, are uninsured and you get in a bad accident or you get very sick, those medical bills could rack up really, really quickly. So we've seen, we actually ran a poll back in 2012 before the ACA went into full effect, asking uninsured young adults across the country why they didn't have health insurance. And of those that we polled, only 5% said that they chose not to have health insurance, even though they had an offer. The vast majority, everyone else, either said they didn't have access to health insurance or they just didn't have an affordable option. The number one thing is that there are tax credits available, that it's going to make plans affordable. So that's just kind of the number one message is affordability and the fact that you're likely to qualify for something. So definitely check it out. And then I'd say the second most important thing is that there is free in-person help available. So navigators and in-person assisters are out there to provide just completely objective, free in-person assistance. They will sit down with you and go through the application process and help you kind of go through that whole thing and understand what you are eligible for and how to kind of compare plans.
I guess I ended up paying more than I kind of thought it would be for one person to be on health insurance. So I guess that could be a little bit of a rude awakening, but it wasn't anything totally crazy by any means.
Really trying to find young people where they are. So going to college campuses, for example, community colleges particularly had uninsured rates as high as 80% pre-ACA, partly because a lot of community college students were, what's called a non-traditional student, people who are older off of their parents' insurance, maybe going to school part-time and working part-time and don't have an offer of employer insurance and a variety of other issues. So it was a great place to kind of try to find young people who needed this message. But again, young people are busy. If you are going to school and also working, you don't have a lot of time to kind of seek out this information on your own. So we really had to kind of go into classrooms, go into, college campus halls and on the quad and, all of that kind of thing.
Yeah, I think if I knew about them, that might be something that if it wasn't through my company and I had to make this decision on my own, I think that would be a really kind of helpful thing. At least to see them compare different plans or whatever. Mm-hmm. 'Cause I don't really know what to look at.
Right. You have to talk to the same person multiple times. It takes multiple touches in order to get someone from the very, first instance of kind of understanding, kind of learning what's going on through completing enrollment and then to actually accessing care. So we kind of try to do a variety of things where we're doing a lot of on-the-ground work. We're doing a lot of work through partnerships and providing resources and materials to partners, as well as doing a lot of digital engagement.
Prior to the ACA, young adults between the ages of 18 and 34 were uninsured at 48% nationally. That number has dropped now to 15%.
So one of the things that we've done for the past 3 years, it should be our fourth year now, is this big kind of day of action called National Youth Enrollment Day. This year it will be on December 10th. So in the past few years, the idea is it's like this giant day of action where we get all of the groups who are working on ACA enrollment or just working with young adults in general to kind of all focus on young adult enrollment for one day or, a few days around this kind of bigger event. So the last couple of years, we've had an average of like 200 events all across the country, and along with a lot of online activities where we've estimated to reach about 2 million people online.
If you are currently struggling to find affordable healthcare and don't know where else to look, visit www.younginvincibles.org for all your answers. Someone will be available by phone or email to help guide you along this stressful process.